Good afternoon. I'm Kim Sang-hee, a gynecologic oncology nurse at the Gynecology Cancer Center at Samsung Medical Center. The patients I mainly care for are gynecologic cancer patients such as uterine and ovarian cancers. Gynecological cancer patients experience changes in their sexual lives due to the removal of the uterus and ovaries, and I provide education on sex life for cancer and surgery patients. We have also been providing education and counseling for female cancer patients at Samsung Medical Center for 10 years, and breast cancer patients are the most frequent participants in these programs. I am honored to have the opportunity to share my experiences and know-how with so many breast cancer survivors at this event. This is something I read in a recent journal as I was preparing for this presentation. Having breast cancer affects your sex life, but why are we not talking about this? 60 to 70% of breast cancer patients experience sexual health issues, and we are now struggling to find a happy outcome to this issue. This is what I'm going to talk about today. I'm going to talk about sexuality in cancer patients. We are going to do some case reviews, what healthcare providers think, and what breast cancer patients think when it comes to sex life of cancer patients. We look at barriers to active sex life in breast cancer patients, change cancer treatment, strategies for coping with changes, as well as breast cancer white paper. Sex life of a cancer patient. This is what healthcare providers think. For doctors, patients alike, sexuality is one of the most important drivers of human life, but when you become a cancer patient, it becomes difficult to talk about this. The overall perception of Korean society is that it is inappropriate to talk about sexuality when you have been diagnosed with a serious disease like cancer and your life is at stake. It's not that we don't think it's important, it's just that we just don't have the time to ask questions about this. But if I do have the time, how would I be able to ask and counsel my patients? I feel like if I ask them, most of my patients would become embarrassed and may even become aggressive. They're like, "Why are you asking me that? Is that important to me right now? Or why would a doctor ask me about something so personal? Is that relevant to my treatment, or is that an invasion of privacy?" So we do have to be cautious when talking about this. And about what breast cancer patients think about sex life now that they have cancer. They say, "I feel like I have a major flaw as a woman, and I can't look my husband in the eye, so our relationship is not going so well. I feel like he wants something from me, but he doesn't really express it directly to me. But I can tell he's unhappy about something. And when I'm going through a chemotherapy, I don't think we should have sexual intercourse while my levels are dropping. But what should I do if he keeps making demands? I am embarrassed to undress in front of my husband after my mastectomy. I think it would be better to have plastic surgery, but I'm worried about the feel of my breasts after plastic surgery. And probably because the hormones that I have taken, I am very dry and it hurts to have sexual intercourse. And I don't have any desires. Hormone therapies suppress estrogen, which is why women lose their sex drive. I have to take these pills for 5 years and I'm worried about what's going to happen with my husband. So are the things the patients tell us. I tell them cancer is no longer a terminal disease. It's thought of as a lifelong condition, like a chronic disease, like hypertension and diabetes. These chronic diseases are related to quality of life. And another thing that is highly related to quality of life is sex. Sex between a couple. Well, love is not just a physical relationship, it's mental. It's about holding hands. It's about exchanging affectionate glances. It's about kissing. It's not all physical. The most important thing is to talk. It's important to discuss things. If you don't talk, misunderstandings build up, which lead to mistrust, and life becomes difficult. Expressions of love, physical contact, and intimacy are essential in relationships. Barriers to sex life in cancer patients. Let's look at this. Pain, fatigue due to cancer, which can be caused by the disease itself, can be barrier, and there can be causes related to treatment, related to surgery, related to radiation therapy, related to chemotherapy. And then there are changes in appearance, psychological withdrawals, feelings of guilt, financial difficulties, relationship with spouses can be the reasons as well. There are things to keep in mind when it comes to sex with cancer patients. There are changes related to cancer treatment processes. Reduced ovary function can lead to early menopause. And with mastectomy, you're going to experience physical changes. You're going to have low sexual appetite, and there's going to be a decline in immune function. You should discuss with your healthcare providers when to become pregnant based on the timing of your treatment, because some treatments such as radiation therapy can cause fetal abnormalities. About changes during cancer treatment. First, the effective early menopause cause treatment. Surgeries to remove the ovaries and the effective chemotherapy, hormonal drugs can cause menopause, which can lead to difficult symptoms such as decreased vaginal discharge, vagina dryness, decreased libido, and dyspareunia. And the second change related to the cancer treatment, this is related to chemotherapy. Anti-cancer drugs can affect ovarian function and cause menstrual cycle as well, and lead to menopause. You also need to be aware of decreased immune function as a side effect of chemotherapy. And if you are to get pregnant, well, these drugs may cause defects in the fetus. You may need to take contraceptives. And the third change related to cancer treatment is related to physical changes. The functioning of organs within the body that are actually involved in sexual activities are normal. However, breast cancer patients experience changes in skin color after resection and radiation therapy, and these bodily changes can lead to low self-esteem and avoidance of sex. So they need the warmth and love of their spouses. This is a healthy sexual response cycle. This progresses from anticipation of sex to arousal of desire to orgasm and resolution. But now, with a cancer diagnosis and cancer treatment, the anticipation is gone, the desire is gone, and it's hard to progress to the next stage. This is a misconception about sex life after cancer treatment. You need to have a uterus to have sexual intercourse. For sexual intercourse, you need a vagina, not the uterus. You don't have to have a uterus to have sex. Cancer cells can be transmitted to your partner? Of course not. Sexual activity can cause cancer to recur or to be diagnosed again. Well, sexual activity caused my cancer, so sex is impossible during cancer treatment. I can't satisfy my spouse. These fears are completely misplaced, and so are the fears about the disease itself. So is it okay for to have a sex life while living with cancer? Of course it's okay. The effects of sex on cancer treatments are very positive because it relieves pain. The release of endorphins relieves headaches, back pains, and muscle pain. It relaxes the muscles, allowing for restful sleep, relaxation, and physical vigor. It delays aging and keeps you healthy. It strengthens cardiovascular function and supports the vaginal health. It keeps the vagina elastic, and it has a lot of mental health benefits. So it promotes the release of oxytocin, which reduces anxiety and depression. And these are changes that come with breast cancer treatment. After surgery, you experience physical changes related to resection. And in terms of chemotherapy, it doesn't directly interfere with your sex life, but it does lower your immune function. So you may need birth control. The best time to have sex during chemotherapy is when you are feeling well after a week or two of chemotherapy, or when your bone marrow function and health are fully restored before the next cycle of chemotherapy. Whenever possible, patients are encouraged to use condoms during cancer treatment to protect themselves from infection. And also, breast cancer patients are restricted from using female hormonal medications. And here are some specific strategies to help you cope with your sex life. The first is use of water-soluble jelly. Water-soluble jelly is something that is often used in hospitals for things like enemas and urinary catheterization when you need a lubricant. This is not a hormonal agent, so it's all flushed afterwards. It's relatively inexpensive, around a couple of dollars, and you can just buy this from a medical supply store. It's more effective if you apply it to yourself first and then your partner when having sex. And strategy number 2 for dealing with sex life changes, it's douche. It maintains a vagina acidity and prevent vaginitis. There's also an added jelly. It helps to keep the vagina acidic because it creates an acidic shield. It protects against infections and inflammation. When you get menopause, if even when you're not having sex anymore, you're going to sometimes get atrophic vaginitis. So it's important to make sure that we're not washing the vagina with alkaline soaps to maintain such acidic shield. The third specific strategy, it's a vagina moisturizer, which is non-hormonal and has about 72-hour effect. It helps with wound healing. It moisturizes the vagina and it increases the elasticity of vagina. So you can use a tool like a syringe to inject it deeply. And this is a fourth strategy. Well, this Kegel exercise, you may have heard about this. It's known as an exercise for incontinence prevention. It increases circulation to the pelvic muscles, increases bladder control, and therefore increases a sexual response. It maintains a quick recovery of perineum. A word of caution. You want to make sure you don't engage the muscles in your stomach, legs, and hips. You don't hold your breath either. You want to do the exercise with normal breathing. These are tools that have been developed to help you to strengthen the perineum. There are these things that you can strap to your thighs, a machine that you can sit on to exercise. So I've actually had patients who have used these tools, and they tell me that they have found them to be very helpful. And when you're doing a perineal strengthening exercises, the areas that you want to target are the anus and vagina. When doing Kegel exercise, it's the anus and vagina. They need to be exercised. And if you have trouble figuring out exactly which locations need to be exercised, think about when you're in the bathroom and somebody suddenly opens the door, and then there's a tensioning rises, and that's the part where you need to apply pressure to. You can do this with your knees up. You can do it like this. You can do it lying down with your legs straight. You can do this with your knees up. You can do it your back elevated. So you can do it many different ways like this. And perineal muscle strengthening exercise can be done several times throughout the day, and you can do this in any position during your daily routine by squeezing your anus and vagina and gradually releasing your lower abdomen. And this is how your spouse can help you. I think this is most important. Showering together, giving foot massages, watching TV together, holding hands together. This is all very important. Your spouse has to be aware that you may be more easily hurt than usual. Spouse needs to be generous with expressions of love, and also needs to observe the patient's sexual needs and help her fulfill those needs naturally. Spouses need to empathize with the pain and consciously try to keep the dignity about sexual identity alive. And it's not good to turn away from their sexual needs because of fatigue. Spouses need to make their partners feel comfortable about expressing their desires whenever they want to, even if they are very physically exhausted from treatment process. This is a white paper on breast cancer. This is compiled by the Korean Breast Cancer Society, and these are the guidelines for the wives. Don't be hurt by your husband's behavior or words, and find a friend who understands your situation. Make sure to express to your husband that you are feeling hopeful about life, and give yourself a pat on the back every morning that you're doing well. Make lifestyle changes and talk to your doctors and follow his or her recommendation 100%. And this is a guideline for a husband. This is from the breast cancer white paper. Be a good listener. Learn how to do a breast cancer self-exams and help with diagnosis. Go to doctor's appointment with your wife. And be understanding about your wife not wanting to have sex. Relieve her of the burdens of housework and children's education. Hug her and make her laugh. And if you continue to build an intimate relationship with faith and care, cancer and surgery will not be able to change your relationship. These are the four most fundamental principles for successful sex life. Don't give up, love your spouse, and talk to your spouse often. And always remember that intercourse is not the only thing in your sex life. And be sure to talk to your healthcare provider if you have any of the following symptoms. If you have new pain during sex, if you have a lot of bleeding, or even if when you have questions and if the conversation is not going well with your husband, ask your health care provider for help. And this is something my patient told me during a consultation a few days ago. She said she was really happy when her husband hugged her from behind while she was preparing a meal in her kitchen. Said she was really happy and loved. The medical staff are always ready to provide you the support you need. I hope my talk has helped with improving sex life, and good luck to you all.